Hello, we're here with gastroenterologist and internal medicine, Dr. Carlos. We're here to ask him some questions about diabetes. Good afternoon, Mr. Carlos.
Good afternoon.
I want to ask you first, which are the main causes of diabetes?
There are several factors. The main one is it is related to heredity, but it is also related with obesity. Sometimes can be related with pregnancy and some medications.
And how serious it is?
The seriousness depends on the glucose levels and how many years does the patient has with diabetes.
And how does it affect the patient's lifestyle?
It can affect several organs like eye, heart, brain, gut, and it can affect the function of each one.
What is the short-term and long-term prognosis for this disease?
The prognosis depends a lot in the glucose levels and the time that the patient has with the diabetes. But it can go from symptoms related to the organ affected to death.
What was the main complaint patients have for consulting?
The main complaints are three: a lot of thirst, hunger, and to urinate frequently.
What other symptoms does the patient present?
The symptoms are related with the affected organ. It can be blindness, heart attack, troubles with the renal kidney function, and troubles with the gut.
How can the patient be tested for the disease, and what do these tests reveal?
Some blood tests should be done so you confirm high levels of glucose and continually weigh.
What are the treatment options?
There are several options. You should start with diet, then exercise, then some medications, and at least insulin.
What is the treatment the patient is receiving?
The treatment depends on the glucose levels and the time that the patient has with diabetes.
And how effective it is?
The effectiveness depends on the glucose levels and the time that the patient has with diabetes. For example, in the patient that needs insulin, it is related to the amount of insulin they need to control the glucose levels at normal.
And what will happen if the patient doesn't get treated?
The damage in the organs are continuous and progressive, and at the time it can lead to death.
What new technologies exist for preventing diabetes?
The best one is to avoid obesity and to make exercise.
And to diagnose it?
There are new exams that can measure the average level of glucose of the 3 previous months. They are very accurate.
What new technologies can be used to treat diabetes?
There are some like new infusion bombs of insulin and artificial pancreas.
Thank you very much, Dr. Elizondo, and thank you for watching our interview.
Thank you.